So for many years, I've been the medical director of perhaps the busiest obesity treatment center in the world. Last year, we had, I think, close to 70,000 billable patient encounters. So if anybody's out there that has a busier clinic than that, you can let me know because I think we run the busiest clinic in the world. I think that my sense of what really works and what doesn't to help people manage their appetite and manage their weight has really solidified into this idea that it's not necessarily that it's this diet or that diet, particularly some magic diet or an obesity code, but it's more or less some basic principles to help people achieve a sense of satiety with their meals. That is a sense of satisfaction, so that when you're finished eating an appropriate amount of food, that you exercise the most important muscles in your body. Well, what muscles are those, you might ask? What's the most important muscles in your body when it comes to weight management? Well, it's the triceps, these ones right here. That's because you need to be able to push away from the table at the right time and say that's enough. Of course, I'm being a bit facetious here, but the idea is that if you can get to the point in your meal where you say, I've had enough, and you can stop there, that's going to be the magic sauce in the long term when it comes to weight management. So how do you do that? It comes about from really three main principles. One is eating a meal that has enough volume, because the first signal that tells you you've eaten enough food is your stomach starts feeling full. The main driver of hunger signals is a hormone called ghrelin. Elevated ghrelin levels are associated with obesity very clearly, and difficulty maintaining weight loss. So maintaining better ghrelin levels, which are lower for the most of the day, that's a good thing. So how do you get ghrelin levels to be suppressed and to stay down? Well, the first signal to lower ghrelin levels is distension of the stomach, because most ghrelin, about 80% of the ghrelin, comes from the greater curvature of the stomach. That's the part of the stomach that gets stretched as you eat a meal. And just understand that most of the food that we eat today is highly calorie dense. It's not volumetric, meaning that there's a lot of calories in a very small volume of food. So if you're going to have, say, burgers and fries for lunch, and you want to have a full stomach in terms of distending the stomach enough to suppress ghrelin, you're going to have to eat probably enough calories that you've gone way over the amount of calories that you need. Eating food that's more volumetric, what does that really mean? It means eating, number one, a lot more vegetables. Eating, for instance, more salads, but finding ways of dressing those salads with lower amounts of calories. One of the other satiety signals early on is eating some fat, because fat triggers the release of something called CCK, cholecystokinin. Comes from largely the duodenum, which is just outside the stomach. So as the stomach contents start emptying into the intestine, CCK is liberated if there's enough fat and protein as well. There's a lot of merit in finding ways to increase the volume of your meals. Volume that doesn't include high glycemic index carbohydrates, starchy vegetables like squash, sweet potatoes. These are foods that have a real satiety benefit. Even potatoes, white potatoes cooked in a way, like for instance, boiled potatoes, are one of the highest satiety-inducing foods there is. Not so much French fries, very calorie-dense food, but boiled potatoes or baked potato with lower calorie dressings is certainly a satiety-promoting food. Maybe adding some fiber supplements to your diet is another way. We've done a lot of research on adding a fiber supplement prior to or with your meals, and that has been shown in even placebo-controlled trials to be a good way of initiating that sense of satiety. The other thing is, if you eat slowly, one of the magical things that happens when you eat slowly, you give your stomach time to start emptying into the small intestine and delivering the initially digested food to the intestinal cells. Nibble a bit, wait, and then realize that you can have more exercise over your willpower by having those satiety hormones rise. So volumetric eating and eating your meals slowly, and then making sure that there's always protein in that meal. Do people need to eat more protein? Generally, no, in terms of the amount of protein per day, but most people pack the protein at the end of the day. It's not enough. In fact, the most important meal for protein is breakfast. Start by eating protein-centric breakfast and low glycemic breakfast. And then the glycemic impact of that food, a big part of satiety is trying to get off a blood sugar roller coaster. The majority of people, especially in this part of the world, are insulin resistant to some extent. And oftentimes that's exacerbated with the meals that they eat. They eat meals that kick their blood sugar up, that releases a great deal of insulin, and that insulin starts to work and it results in a rapid drop of blood sugar. And that's been shown to trigger an urgent sense to eat in the brain. It doesn't require necessarily a low-carb ketogenic diet. You don't have to go full-on ketogenic to get this effect. You just have to make sure you get off the blood sugar roller coaster. But you can definitely include some healthy carbohydrates in your diet and have really stable blood sugar. A diet that has more of a pattern, kind of like the healthy plate. Like the Modern Canada Food Guide is a good example of what is a good diet to promote satiety. It's more volumetric, it's got protein at each meal in moderation, it's got low glycemic index carbohydrates at each meal. It's often a diet that's less expensive, and it's even a diet that's simpler. So overall, the good news is that I don't think you have to believe in the latest diet craze, because the things that aren't as sexy often are the things that really work in the long term.